12. Occupational exposure limits. Definition of terms/types of EOLs. TLV. Registered TM of ACGA, American Conference of Governmental Industrial Hygienists. Not a standard. Not a regulatory board. TLV, threshold limit value. Used by DOL. Enforceable part of OSH standards. HEL. Permissible exposure limit. REL. Recommended exposure limit. The following organizations and government agencies have the following OELs. Department of Labor and Employment, FILS, threshold limit values, TLVS. OSH standards. Rule 1070 Control of physical and chemical agents. Threshold limit values, TLVs. Permissible exposures. Work environment measurements. WEM, should be done annually. Rule 1090 Hazardous materials. Rule 1096.08. Workers exposed to lead shall be subjected to periodic physical examination and laboratory examination at intervals of not more than 6 months, and where the degree of contamination rises above the threshold value, such physical examination shall be conducted at least once every 3 months, and a record of such examinations shall be open to authorized agents and to the exposed workers. OSHS, Rule 1960 Occupational Health Services. Every employer shall establish in his place of employment occupational health services in accordance with the regulation and guidelines provided for under this rule. Requirements for medical personnel in workplaces. Duties of employers, physicians, nurses, first aiders. Rule 1960, Occupational Health Services. Objectives of OSH services. 1. Identification and assessment of health hazards. 2. Surveillance of factors in working environment and working practices. 3. Advice on planning and organization of work. 4. Participation in development of programs for improvement of working practices. 5. Advice on occupational health, safety and hygiene, ergonomics and PPE. 6. Surveillance of workers' health in relation to work. 7. Promoting adaptation of work to workers. 8. Collaboration in providing information, training, and education in OIH and ergonomics. 9. Organizing of first aid and emergency treatment. 10. Participation in analysis of occupational accidents and occupational diseases. Rule 1960, Occupational Health Services. Rule 1966.02, the Occupational Health Program. Health examinations, entrance, periodic. Special, transfer and separation. Diagnosis and treatment of all injuries and occupational and non-occupational diseases. Immunization program. Health education and counseling. Health records maintenance. Nutrition program supervised by dietitian and physician if the latter is present. Dole Order No. 119 to 12 Rules implementing Republic Act No. 10,151. An act allowing the employment of night workers, thereby repealing Articles 130 and 131 of Presidential Decree No. 442, as amended, otherwise known as the Labor Code of the Philippines. Section 3. Health assessment, without charge and to receive advice on how to reduce or avoid health problems associated with their work. Section 4. Mandatory facilities, shall be made available for workers performing night work as provided by OSHS Rule 1960, etc. Labor Advisory No. 03-16 Safety and Health Measures to Prevent and Control Heat Stress at the Workplace. Date posted, April 14, 2017. Prevent Heat Stress in the Workplace infographic. ASCII. Alt. Department Order No. 136 Series of 2014, Guidelines for the Implementation of Globally Harmonized System, GHS, in Chemical Safety Program in the Workplace. Section 6. Chemical Safety Program Elements. The chemical safety program to be initiated by the establishment shall include the following elements. H. Occupational health and medical surveillance. The establishment shall comply with Rule 1960 of the OSHS. Do 178 to 17 Safety and health measures for workers who by the nature of their work have to stand at work. Date posted, August 25, 2017. Do 184-17 Safety and Health Measures for Workers Who, by the nature of their work, have to spend long hours sitting. Date posted, October 18, 2017. PD. 626 Employees Compensation and State Insurance Fund. Prescribed minimum standards for periodic medical examinations designed for the early detection of occupational diseases. Exposure to occupational hazards enumerated in the list of occupational diseases is a requirement to undergo periodic medical examinations. Employees Compensation Commission Board Resolution No. 13-1136. Musculoskeletal disorders. Refers to traumatic and non-traumatic inflammatory, degenerative, and acquired conditions affecting muscles, tendons, ligaments, joints, peripheral nerves and blood vessels. Disorders of the spine, shoulder, elbow, wrist, and hand, knee, ankle and foot. Exposure to trauma, forceful and repetitive work, lifting, vibration, improper posture in the performance of assigned tasks. OSHA, Permissible Exposure Limits, PELS. Occupational Safety and Health Administration, OSHA Permissible Exposure Limits, PELS. OSHA has enforceable occupational exposure standards for airborne contaminants termed Permissible Exposure Limits, PELS. PEL, primarily 8-HR-TWAS. STEL C. Action levels. Defined as 1/2 the value of the permissible exposure limit, PEL. Early warning systems to proceed with the following. I. Employee notification. 2. Employee monitoring. 3. Employee training. 4. Medical surveillance. ACCA, threshold limit values, TLV. 3 categories of TLVs. TLV time-weighted average, TLV-TWA. Time-weighted average concentration for a conventional 8-HR workday and a 40-HR workweek, to which nearly all workers may be repeatedly exposed, day after day, without adverse effect. Alt. It is inherent in the definition of TWA that airborne concentrations greater than the OEL TWA are permitted for periods of time during the workday as long as these concentrations are offset by periods of lower concentrations. TLV short-term exposure limit, TWA STEL, usually 15 minutes. Concentration to which workers can be exposed continuously for a short period of time without suffering from 1. Irritation. 2. Chronic or irreversible tissue damage. 3. Dose rate dependent toxic effects. 4. Narcosis of sufficient degree to increase the likelihood of accidental injury, impair self-rescue or materially reduce work efficiency. 15-minute TWA exposure which should not be exceeded at any time during the workday even if the 8-HR TWA is within the limits. Exposures above the TLV TWA up to the STEL should not be longer than 15 minutes and should not occur more than 4 times per day. STELs are recommended only where toxic effects have been reported from high short-term exposures in either humans or animals. Example, acetic acid, TLV TWA, 10 ppm, TLV STEL, 15 ppm. Alt. TLV sealing, TLVC. Concentration that should not be exceeded during any part of the working exposure. TLVC recommendations are particularly valuable for exposure to irritant gases/vapors. X. Hydrogen chloride TLVC 5 ppm. Surface limits, TLVSL, basic concepts. TLVSL the concentration on workplace equipment and facility surfaces that is not likely to result in adverse effects following direct or indirect contact. Is intended to supplement to airborne TLVs, especially for substances with skin, DSEN, and / or RSEN notations, and A1 and A2 carcinogen categories. Intended to protect against systemic toxicity, sensitization, and cancer from contact with contaminated work surfaces. Examples of recent TLVSLs. Othalaldehyde, 2019, methyl tetrahydrophthalic anhydride isomers, 2019, benzoquinone, 2020 tunic, ethylene glycol dinitrate, 2020 tunic, methyl naphthalene, all isomers, 2020 tunic, propylene glycol dinitrate, 2020 tunic. Other notations. Skin. The designation skin in the notations column refers to the potential significant contribution to the overall exposure by the cutaneous route, including mucous membranes and the eyes, either by contact with vapors of probable greater significance, by direct skin contact with the substance. Skin notation also alerts the industrial hygienist that overexposure may occur following dermal contact, even when airborne exposures are at or below the TLV. SEN. The designation SEN refers to the confirmed potential for worker sensitization as a result of dermal contact and/or inhalation exposure based on the weight of scientific evidence. New terminology, RSEN/DSEN, respiratory and/or dermal sensitization. The SEN notation does not imply that sensitization is the critical effect on which the TLV is based. Lack of sensitizer notation does not necessarily mean that the substance is not a sensitizer. EXM-butylacrylate, formamide. Threshold limit values for mixtures. Most TLVs are developed for single chemical substance. However, the work environment exposes workers to multiple chemical exposures. The general ACCA mixture formula applies to the additive model. It is utilized when additional protection is needed to account for this combined effect. When two or more hazardous substances have a similar toxicologic effect on the same target organ or system, their combined effect should be given primary consideration. Mixtures of chemicals. Based on the additive model, TLV-TWA and TLV-STEL. Components have similar toxicologic effects. OEL mixture equals C1 over OEL1 plus C2 over OEL2 plus C3 over OEL3 plus Cn over OELn plus ASCII. Alt. Cn concentration of particular chemical. OELn equals OEL-TWA for that chemical. Where there is no STEL, use STEL equals 5x TLV-TWA value. If OEL mixture is less than or equal to 1, the exposure of the mixture combination is within acceptable limits. Example, a worker's airborne exposure to solvents was monitored for a full shift as well as one short-term exposure. Agent. Full shift, TLV-TWA. TLV-STEL. Acetone. 80 ppm, 250 ppm. 325 ppm, 500 ppm. Cyclohexanone. 2 ppm, 20 ppm. 7.5 ppm, 50 ppm. Methylethylketone. 90 ppm, 200 ppm. 220 ppm, 300 ppm. Evaluate full shift and STEL values. NIOSH, Recommended Exposure Limits, RELS. National Institute of Occupational Safety and Health, NIOSH, Recommended Exposure Limits, RELS. There are 3 RELs established by NIOSH. TWA. STEL. Sealing. IDLH, Immediately Dangerous to Life and Health, Toxic Gases. NIOSH defines an IDLH, Immediately Dangerous to Life and Health, exposure condition that poses a threat of exposure to airborne contaminants when exposure is likely to cause death or immediate or delayed permanent adverse health effects or prevent escape from such an environment. AIHA, Workplace Environmental Exposure Levels, WELS. American Industrial Hygiene Association, AIHA Workplace Environmental Exposure Level Guides, WELS. WELS are established only for substances for which there is no currently available workplace exposure standard, OSHA, or recommendation, TLV. Comparison of OELs. Type of limit. Recommending body. Binding. Permissible exposure limit, PEL. Occupational Safety and Health Administration. Yes. Recommended exposure limit, REL. National Institute for Occupational Safety and Health. No. Threshold limit value, TLV. American Conference of Governmental Industrial Hygienists. No. Workplace Environmental Exposure Level, WIL. American Industrial Hygiene Association, AIHA. No. Now Chemical Exposure Limit, NCEL. Environmental Protection Agency, EPA. Yes. Maximum Allowable Concentration, Germany, MAC. Commission for the Investigation of Health Hazards of Chemical Compounds in the Work Area. Yes. Occupational Exposure Limit, DEL. Health and Safety Commission and Health and Safety Executive, Britain. Yes/no. Emergency Response Planning Guide, ERPG. AIHA, Community-Based Standard, not an OEL. No. Reference Concentration, RFC. EPA, community-based standard, not an OEL. Yes. Table 5:1. Full shift airborne occupational exposure limits developed by various organizations. OEL. Definitions. ACCA TLV. Threshold limit values, TLV, refer to airborne concentrations of chemical substances and represent conditions in which nearly all workers may be repeatedly exposed, day after day, over a working lifetime, without adverse health effects. TLVs are developed to protect workers who are healthy adults. They do not distinguish between safe and dangerous exposures, nor are they a relative index of toxicology. AIHA or SWEL. The workplace environmental exposure levels, WELs, are health-based, airborne chemical at OELs established to provide guidance where other OELs are not available. This guidance protects most workers from adverse health effects related to occupational chemical exposures. WELs are expressed as either time-weighted averages or ceiling limit. DFG MAC. The MAC values are daily, 8-hour time-weighted average values that apply to healthy adults. MACs give the maximum concentration of a chemical substance in the workplace. EC SCOL. The SCOL time-weighted average exposures represent the levels to which an employee may be exposed via the airborne route for 8 hours per day, 5 days per week, over a working lifetime without adverse effects on the health of the worker or his or her future children. NIOSH REL. RELs are occupational exposure limits designated by NIOSH as being protective of worker health and safety over a working lifetime. The REL is used in combination with engineering and work practice controls, exposure and medical monitoring, labeling, posting, worker training, and personal protective equipment. This limit is frequently expressed as a time-weighted average, TWA, for up to a 10-hour workday and a 40-hour workweek. OSHA PEL. OSHA sets enforceable permissible exposure limits, PELs, to protect workers from the exposure to hazardous substances. PELs are regulatory limits on the amount or concentration of a substance in the air. OSHA PELs are based on an 8-hour time-weighted average, TWA, exposure. OEL for airborne substances. Occupational exposure limits for airborne substances are limits on the magnitude, concentration, and duration of employee exposure to these substances. Set for airborne workplace contaminants by numerous countries and scientific organizations worldwide. Early attempts at OEL development. Max Gruber, Hygienic Institute at Munich, 1883. 2 hens, 12 rabbits exposed to carbon monoxide for up to 47 hours over 3 days. The boundary of injurious action of carbon monoxide lies at a concentration in all probability of 500 parts per million, but certainly, not less than, 200 parts per million. KB. Lehman, et al., 1880s to 1930s. Studies on ammonia and hydrogen chloride gas, chlorinated hydrocarbons, and a large number of other chemical substances. Cobert, 1912, published a table of acute exposure limits. 20 substances, listed under the headings, 1. Rapidly fatal to man and animals, 2. Dangerous in 0.5 to 1 hour, 3. 0.5 to 1 hour without serious disturbances and, 4. Only minimal symptoms observed. U.S. Bureau of Mines, 1921. Values for 33 workplace substances listed are those encountered in workplaces. OEL timeline. 1883 Gruber, first OEL for carbon monoxide, 1916 South Africa gold mines, exposure limits for dust with high quartz content, 1921 U.S. Bureau of Mines, exposure limits for 33 substances encountered in workplaces, 1941 ACCA, first list of standards for maximum allowable concentrations of workplace chemicals, 1945 Cook, list of max for 132 industrial atmospheric contaminants, 1942 ACCA, table of maximum allowable concentrations of 63 toxic substances, 1970 U.S. Congress, TLVs adopted into Occupational Safety and Health Act. Alt. Setting exposure limits, dose response data. Reason for measuring, estimating, worker exposure is an attempt to evaluate the real potential health significance of the exposure. Sources of data for establishing OELs and endpoints considered. Human industrial exposure. Chemical analogy. Chronic, long-term, inhalation studies using experimental animals. Experiments with human volunteers, controlled exposures. Chronic, long-term, oral exposure studies using experimental animals. Acute, short-term, inhalation and oral studies using experimental animals. Exposure limits may be complicated by the following factors. Limited toxicity information. Extrapolation to humans, usual conversion factor, 10. Human variability. Uncertainty factor. Interpretation of unacceptable responses. Desired margin of safety. Uses of OELs. Intended for use only for establishing acceptable levels of exposure for workers to airborne substances in the workplace. Duration of exposure relevant to the PEL's development and use are given. 8 HR workdays, 40 HR workweek. OELs should not be used. 1. As a fine line between safe and dangerous situations. Not all workers will respond in the same way to a given exposure level. 2. As a relative index of toxicity. While two chemicals may have the same OEL, their toxic effects may be totally different. N-hexane and nitrous oxide, 50 ppm TLVTWA. 3. In the evaluation or control of community and air pollution nuisances. Does not consider effects on children and elderly. 4. In estimating the toxic potential of continuous, uninterrupted exposures or other extended work periods. 5. As proof or disproof of an existing disease or physical condition. Other factors must be considered in establishing causal relationship. Summary. Biological monitoring and medical surveillance are useful tools for occupational health experts, including industrial hygienists, to assess exposure and the adequacy of control measures. Biological monitoring should complement air monitoring, or workplace environmental monitoring, in industrial hygiene investigations. Surveillance data will provide trends or emerging patterns in workplace hazards and illnesses. Periodic, systematic, and continuous hazard assessment and medical examination. Biological monitoring, in certain conditions, and medical surveillance, in all conditions, are conducted to meet regulatory requirements. The ultimate goal is prevention of adverse effects from workplace exposure.